In British Columbia, our goal is to have the best ambulance system in the world, providing the best possible service. When we need help, we call 911, and we must know that help is on the way and quickly. That's the commitment, the unspoken partnership. As our COVID-19 case counts declined and our comfort with returning to the healthcare system increased, so did our calls to 911 for help when we felt it was necessary. And most recently, the extreme heat wave, one that claimed the lives of many people, added to the expectations of our emergency responses. All of these events have brought a focus to this fundamental partnership. When we call 911, we need an ambulance. We need to know it's on the way now. As government, we recognize the importance of the ambulance service, and since day one in 2017, we've worked to make it better. Since 2017, we've increased the BC Emergency Health Services budget from $424.25 million to $559.12 million, which is a significant increase. We've doubled the average annual spending increases compared to previous years. This has meant more paramedics, more dispatchers, and more ambulances on the road. Between 2017 and 19, BC added 119 paramedic positions to support direct patient care, improve service and response times, and modernize dispatch operations. Since January 2021, 271 paramedics have been hired by BC Emergency Health Services. We negotiated the first collective agreement in recent times with QP Local 873, the union representing BC Emergency Health Service workers, and in fact, we gave them, that union, that bargaining unit, the ambulance paramedics at BC, the right to negotiate directly with us again solely in support of the services in the ambulance service. And these are all important steps. But the events of the last few weeks make it clear that there's more work to be done. That essential partnership, the necessary confidence that when we call 911, help is on the way, has been tested. And now it needs to be strengthened and restored. Let there be no doubt our emergency health service system must work better for the people who call upon it and for those who answer the call for help. We know that all British Columbians, regardless of where they live, count on timely and effective access to emergency services, not just for themselves, but for everyone. When you call for an ambulance, it becomes the most important public service government provides and a community can provide. And I think that I want to note the pressure on the ambulance service in this period has been considerable. And I just want to put it in context. We have in our ambulance service a number of different types of calls. The most urgent calls, high priority calls, are purple calls, then red calls, and orange calls, and then yellow calls. But purple calls are calls that are deemed life-threatening calls, and we've seen a very significant increase in those calls. But I want to give you a sense of the kind of increases in 9/11 event volumes we've seen in the last couple of years that have really spiked since we've started to open up with our renewal plan on May 25th. Overdose cases, when you compare the first 6 months of 2021 to the first 6 months of 2019, compare those periods, have increased by 28%. That's 3,530 increase in events, one period compared to the other. Chest pain, 11% increase, or 2,136 increases in events. Abdominal pain, 14% increase, 1,174 increase in events. Heart problems, 24% increase, 1,068 increase in events. These are the challenges facing our ambulance service. And as we've increased the budget by 7.9% a year, so have the demands on that service. And we need to respond and meet the test of those demands to provide the service people need. And that's why today I'm announcing measures to renew BC's ambulance service. This effort builds on the progress we've already made. It strengthens BC's ambulance system. It ensures BC's ambulance system is faster and more responsive to British Columbians. It makes BC's ambulance system a better place to work for paramedics and dispatchers. And it ensures BC's ambulance system can rapidly meet changing demands and needs through focused and direct leadership. To ensure the direct leadership of ambulance services, I'm reconstituting the BC Emergency Health Services Board of Directors to focus solely on ambulance services. The board will be directly accountable to me with a clear mandate to ensure better service for patients and families who rely on the service and better supports for workers who deliver the service. Chairing the board, and I'm very proud to announce this today, and he's here with us today, will be Jim Chu, the former Chief Constable of the Vancouver Police Department. Jim Chu has extensive experience leading frontline emergency service in BC. He'll provide the focused governance leadership BC Emergency Services needs to be an effective and high-performing ambulance service. In addition, I've asked, and he's accepted, Darren Entwistle, the President and CEO of TELUS, to serve as a special advisor to the board. I'm also directing the BC Emergency Health Services now be led by a Chief Ambulance Officer responsible for the day-to-day management of the BC Ambulance Service. And I'm appointing Leanne Heppel to serve as Interim Chief Ambulance Officer. Ms. Heppel's role is to focus solely on ambulance services, working shoulder to shoulder with paramedics and dispatchers to deliver the best ambulance service in the world that provides the highest level of service for those who need help and the strongest support for those who deliver it. Ms. Heppel is a trained clinical nurse specialist currently working as Providence Healthcare's Chief Operating Officer, Acute Care, and Chief of Professional Practice and Nursing. She has 20 years' experience with Vancouver Coastal Health, Fraser Health, and previously with the BC Ambulance Service. This is a critical role, and Ms. Heppel's experience and expertise will serve British Columbians well. We are acting immediately to reinforce ambulance operations. We're providing funding for 85 new full-time paramedics, 30 full-time dispatchers, 22 new ambulances, and moving to convert rural ambulance stations to 24/7 Alpha stations in response to needs in the interior British Columbia in particular and on Vancouver Island, where the demands and needs of ambulance service are different but equally required. To get paramedics and ambulances back on the road more quickly and responding to patient calls, I'm directing health authorities to add more staff to receive patients and care for them when they arrive at emergency departments. This will have, I think, and many people, if you speak to ambulance paramedics, will tell you delays in being able to deliver and then leave emergency rooms for ambulance paramedics is an impediment to the delivery of service, and we will work to ensure that that changes. This immediate action on operations, as well as stronger leadership and increased investment at BC Emergency Health Services, will deliver a more effective ambulance service for patients and families depending on it. And of course, we have to support our workforce, our ambulance paramedics, our dispatchers, who continue to deliver extraordinary responses, I think, during two public health emergencies, both the overdose public health emergency and the COVID-19 public health emergency, and in circumstances and challenges like we've seen with extreme heat in recent weeks. The backbone of any ambulance service is people. I know that our emergency service staff are feeling overwhelmed and frustrated, whether it's helping people with COVID, the toxic drug supply crisis, or the heat wave. Their every action is motivated by a commitment to provide support and care for all of us. It's time for us to do a better job providing support and care for them. I'm directing BC Emergency Health Services to take immediate action to support workers, in addition to the significant actions that have been taken pursuant to the collective agreement we signed with QP Local 873. As a first step, BC Emergency Health Services will contract a team of mental health and wellness professionals to work directly with dispatch staff and paramedics to address chronic stress, fatigue, and support wellness among staff. British Columbians expect BC Emergency Health Services to be an employer that fully supports emergency workers in the crucial work they're trained to do and are committed to doing. This action taken today ensures achievement on that front. To ensure British Columbians who call for help get the quickest and possible emergency health response, we are returning to pre-COVID-19 first responder dispatching practices for 911. The province is also directing the Emergency Medical Assistance Licensing Board to complete their examination and recommendations on the expansion of firefighters' scope of practice. The deadline for recommendations will be September 6, 2021. Consultations with stakeholders will follow those recommendations, but a decision will be made presently. We need everyone providing emergency services to be all in together. And the measures I'm acting today will benefit from continued collaboration between BC Emergency Health Services and the ambulance paramedics of BC. They are working together right now and have identified, and we'll be sharing this with you, a range of measures to address employee wellness, operational performance, workload, response times, recruitment and retention, and public engagement. And that work has been going on, and I thank the ambulance paramedics of BC, QP Local 873, for their work with us over the last number of weeks to make improvements in all of these areas, and our commitment to work together, I believe, on both sides is profound. We recognize the importance of this work, and we strongly support the constructive and cooperative approach we've seen from everybody. The work to make BC ambulance service the best in the world for those who count on it and those who respond to the call for help starts today. I want to thank all of our emergency services workers who are working flat out right now. Yesterday, 1,711 calls to BCEHS. The pre-pandemic normal was 1,540. And 1,711 was less calls than we'd received the previous 7 days. The pressure, the consistent pressure, the demands on our ambulance service continue to grow, particularly in our most serious calls. I want to thank all of those workers who are involved in that right now. And once in place, the new board and chief ambulance officers will immediately act to ensure faster ambulance response times for all British Columbians, work with the union to focus on areas where the challenges are greater, and by no later than fall 2001, provide advice to the government on the resource and operational changes necessary to achieve BC Emergency Health Services renewal and the promise it holds for us all. When we need help and we call 911, we need to know, we must know that help is on the way and quickly. And that commitment, that unspoken partnership is powerful and essential to so much of what we all believe about our healthcare system. We won't stop until that commitment is fulfilled. I want to now take a moment to ask Jim Chu to come up and say a few words, and then we're happy to take your questions. Jim?
Thank you, Minister. Good afternoon. Let me begin by first thanking Minister Dix for asking me to take on this new role. The reason I said yes, I think I speak for all British Columbians when I say that when you call 911 and ask for an ambulance, the help is on the way promptly. In my 35 years as a police officer, I had the opportunity to work with many frontline paramedics, and later in my career, I worked with their leadership teams. I look forward to reconnecting with some of those old acquaintances, but I especially look forward in my new role to connecting with frontline paramedics, frontline dispatchers, meeting with them, speaking with them, finding out the challenges they're facing on the front lines every day while they serve the public in British Columbia. I also look forward to working with their union leadership. I think with our new chief ambulance officer, as well as the input of our employees, I think we can be collaborative, reach consensus to make the ambulance service as efficient and as effective as it can be. In closing, I also want to say that it's really important that we create a supportive work environment for all our frontline workers, and I look forward to working with our employee groups to make sure that the employees feel valued and supported. Thank you.
Thank you, Jim. And I just wanted to say that, I spoke to Jim a few days ago about taking on this role, and his willingness to do so is an act of public service. We know that being the chair of a board such as this is a part-time position, and it's in addition to his considerable responsibilities in his full-time job. And the fact that he stepped up immediately to take this on is I think, a tribute to his commitment to people in BC, and I'm so proud to have him with us as we move forward with these changes.